I remember the day. It's going to work that morning, and as I was walking in, I didn't feel good. My leg gave out on me. I just fell, and I don't remember falling.
He came and showed up in our emergency department here, and they did a CAT scan, and they actually found that the problem was what's called a chronic subdural hematoma, a collection of blood over the surface of his brain.
Prior to that day when I fell, I had this headache that started from like the temples, went to the back of the head, and went down to the shoulders. Before, I couldn't like really concentrate, and I was so fatigued.
The way Jerome presented with fairly nonspecific symptoms in addition to headache and perhaps a little bit of weakness on the left side of the body is not at all uncharacteristic of the way that people with chronic subdural hematomas do present. And that's why it can be such a difficult diagnosis to figure out, not only for the patients and their families, but also for physicians, because there's a lot of things to consider because nothing really points to this diagnosis until somebody gets a scan.
Dr. Fiorella, he took a look at my x-rays, and he came into the room and he told me he needs surgery right away.
Typically that would be treated in the past with an open surgical procedure. And so somebody like Jerome would be admitted to the hospital. He'd have to undergo general anesthetic and then have a surgery where they actually drill holes into the side of the skull or remove a piece of the skull and then remove or evacuate this fluid collection, this blood collection over the surface of the brain to relieve the pressure. And that's the way things have been done for decades. Some people would even suggest centuries before this new technique to treat subdural hematomas was developed here at Stony Brook. And so what we realized is that this accumulation of blood that occurs over the surface of the brain is from a slow leakage of new blood vessels that have grown over the surface of the brain, typically from a previous trauma or sometimes just spontaneously. We had done these cases clinically for a while and then started realizing that this was really possibly a very, very effective treatment for patients like Jerome, and that perhaps we could do a prospective trial to determine whether this worked or not.
They started telling me exactly what type of procedure it was, and I was like, wait a minute. I think I worked on it. We worked with the scientists that helped Dr. Fiorella with the procedure. So when he started to explain it, and I started going, wait a minute, that's the same thing that we did in our lab. It just came full circle for me and saved my life.
After the embolization of these blood vessels, that leakage could no longer occur. And so Jerome's own brain then naturally started to resorb this fluid collection. And ultimately, over the course of the next couple of weeks, all of his neurological symptoms ultimately dissipated over that same course of time. And he was able to sort of regain a normal life after he'd been so gradually impaired by this process that had been going on.
After the operation, I felt great. I had the procedure. Within 2 hours after the procedure, I was watching TV, talking to my wife.
The trial has shown is probably going to be an excellent option for hundreds of thousands of patients going forward. And so there are many, many people who will be helped by this new and innovative technique that was developed here at Stony Brook. A story that we hear all the time is like grandpa fell and broke his hip. And, he's never been the same since that point. A lot of times they think these patients are becoming demented. They typically are older patients in their 60s, 70s, 80s. And they think this is just a normal progression of cognitive dysfunction. A lot of times these patients don't get scanned. And so we think that this chronic subdural hematoma problem may be a large undiagnosed cause of dementia, cognitive disorders, and just general decline in the status of older patients. Many of these patients, after they're treated, and we hear this, they say, thank you, you've given us our grandmother or grandfather back. The STEM trial is really something I think that highlights what is special here about the Stony Brook Cerebrovascular Center. And so this procedure was something that we pioneered and started here. Not only did we conceive of the treatment itself, but also designed the trial and the protocol for the trial along with one of my collaborators, Dr. Adam Arthur at Semmes Murphey Clinic in Memphis, who's also one of the first pioneers of the procedures. We think that these trial data, along with several other concurrent trials now that other sponsors are running, together will change the paradigm for the management of this most common cranial neurosurgical procedure.
If I didn't go to work that day, I would have never met Dr. Fiorella, and I probably wouldn't be here now. So I basically owe him my life. I really do.